Hello, Dr. Stephanie Gray with the Integrative Health and Hormone Clinic and Your Longevity Blueprint Nutraceuticals. At our clinic, we help men and women build sustainable and optimal health so that they can focus most on what matters to them. So today I want to briefly share what I feel the top 7 supplements are for men's health. Now these nutrients are each equally important for various reasons, like preventing heart disease, which is obviously very common, enhancing hormone levels like testosterone, optimizing bone density, and even providing a healthier mental outlook. Many men are low in these nutrients for the same reasons women are low, things like alcohol, tobacco, caffeine use, stress, and the medications they take, like antacids and NSAIDs. So excess exercise and stress can further deplete nutrients, as can malabsorption of nutrients from conditions like leaky gut, which can stem from food sensitivities. Now in my practice, it seems that my female patients are a little more diligent at taking their supplements than the men. So I'm going to start my recommendations for men's health with really taking a multivitamin, a high quality capsule multivitamin, because that's going to cover the bases, right? If they take nothing else, if I can get my male patients to take a multivitamin, then I feel like I have succeeded at something. So my favorite multivitamin that also is going to contain antioxidants of ours is called Mitochondrial Complex, and I've had other blogs on this product if you want to learn more. So that's first recommendation. Secondly, I recommend men take vitamin D. Now, vitamin D can help support bone density, your mood, your energy, and even immune health. So strong evidence suggests that the higher the level of your vitamin D, the reduced risk of all chronic diseases. So how do you accomplish this? Well, first get your level checked. You likely need a little more than the RDA, which is really more like a minimum. That's the recommended amount to prevent a deficiency, not to fix the deficiency. So work with a healthcare provider to tailor your dosage. Now, vitamin D comes in 5,000, 10,000, even 50,000 short term, which you might need to get your levels up. But your need may vary based on season, right? How much sun you're getting, how much vitamin D you're getting from diet also. So thirdly, if you're going to take vitamin D, I recommend you also take K2. So we have a vitamin D3 plus K2 product. We have a liquid and a capsule. And the importance of K2 is that although vitamin D helps calcium get absorbed, the K2 directs the calcium into the bones, so you don't get calcium built up in your arteries, right? Increasing the plaque, increasing risk for cardiovascular disease, and even potentially increasing kidney stone risk if that calcium goes to the kidneys, right? So K2 is the third nutrient I recommend for men's health. So if they're going to take vitamin D3, they should also take K2 with that. Next, I recommend magnesium, which is a soothing, calming mineral. I think everybody needs magnesium. It's a cofactor for 300 enzymes in the body. Half is found in our bones. So it's not just important for bone density, though. It's also necessary for hormone production, and it can help with sleep as it relaxes our mind. It can help relax our muscles and our bowels, and can even maximize heart and nerve health. So this dose can also be tailored to one's individual needs and symptoms. If individuals get diarrhea, then I recommend they back down a little bit, but you're going to run a less likelihood of getting diarrhea from magnesium if you're taking a capsule like our product, the magnesium chelate. Next, omega-3s. Omega-3s are essential, meaning we must obtain them from our food or from supplements. And if you don't have a coastal diet and access to fresh fish, you likely need to supplement. So omega-3s are important for eye and brain health. They're also very important for females, for pregnant and breastfeeding mothers, but from a male standpoint, they have tremendous cardiovascular benefits. They can help reduce insulin resistance. They're great for reducing inflammation found in autoimmune diseases as well. So we want to preserve our memory, we want to not get heart disease, and fish oil, omega-3s can really help prevent those. When looking for a product though, make sure you find something that contains both DHA and EPA. So DHA is great for hormone signaling, and EPA helps reduce inflammation. Also assure your product is sourced from small fish like sardines and anchovies, and distilled from heavy metals. The triglyceride form is also best, and many companies do not put their fish oil in that product or in that form. Many times the fish oil comes in an ethyl ester form. You want to look for a triglyceride form, and that's what we carry. Starting dose on that is usually about 1 milligram per day. So next, for men's health, I recommend CoQ10. So CoQ10 is a fat-soluble nutrient. It helps produce cellular energy, and you do make less as you age. It is a well-known antioxidant, so that will protect us against oxidative stress and free radicals. It's wonderful for heart disease again. So you've heard me say heart disease many times here. What we're trying to do is obviously reduce heart disease as we age. And so CoQ10, magnesium, omegas, many of the things I've recommended can help there. CoQ10 can also help reduce muscle weakness and fatigue and muscle pains. Many patients are on statin medications to lower cholesterol, and they get the muscle pains from those medications primarily because CoQ10 has been depleted. So taking CoQ10 can help minimize that side effect. And lastly, if men are struggling with high blood pressure or erectile dysfunction, then I recommend nitric oxide boosting products, things like our NOx or NOx support. That also contains quercetin and grapeseed extract, and then the main ingredient there is citrulline. So that can help us maintain the elasticity of our cells lining our blood vessels and enhance our nitric oxide levels. So hopefully those are some helpful suggestions. Again, if nothing else is taken, at least the mitochondrial complex would be a wonderful addition. Always know that if you're taking supplements, you should alert your healthcare provider and work with them on dosing that's right for you. You can learn a lot more about supplements in my book, Your Longevity Blueprint. Thank you for tuning in. Please subscribe to our YouTube channel, and remember that wellness is waiting.